Hi, Dr. Sachs, Christine Grogan with Brave. Thank you so much for taking the time to be with us. I know this is a new assignment for you, being the chief over at Washington University, St. Louis. Dr. Sachs, when I first met him, he was the vice chair over at Hopkins. So he's went from the East Coast to more the Midwestern, and I see that beautiful greenery out back. So not a bad trade-off. Hopkins to Wash U. Thank you, Dr. Sachs. I'll give a little bit of background on Dr. Sachs. His credentials speak for himself. Basically, I went to print this off, and a little glitch in my computer this morning. But the medical school, obviously, he grew up in Brooklyn, and he went to Mount Sinai for med school, grad school. He did residency Mount Sinai. He also did some fellowships in microsurgery, hand surgery at Penn. Microsurgery, I mentioned, it's important I talked about microsurgery a little bit. We talked with Dr. Johan last week how important microsurgery is when you're doing these very particular procedures with nipple resensation, things like that. So we may talk about that a little bit today. He then went on to where I live now, Texas, did microsurgery, cancer reconstruction at MD Anderson, and has an amazing background, philanthropic, everything. I believe he's the president of the PSRC, if I'm not mistaken. Past president. See, I left the industry a few months ago, and I need to stay current.
They're moving fast now, Christine. They're moving fast.
But with that, Dr. Sachs, we're a minute and a half in, and there's just so much more I could say about you. But I really love to have you talk to patients, whether they're in your city or around the United States. People watch, and through the COVID, I know breast reconstruction is considered elective procedure, but maybe you could tell us a little bit about how you're handling it at your university and what are the next steps.
Yeah, no, Christine, thanks again for inviting me to speak in this forum. And, I know you've done some great work both on the industry side and then in this sort of charitable organization. It's really incredible to see it, and the website's fantastic and the information is tremendous. I do mostly cancer and trauma reconstruction head to toe, but about 50% of my practice is breast reconstruction. And breast cancer doesn't stop. It continues to afflict women and men around the world. And during this time, even during our time with COVID, so I started this new job February 1st, moved out here and started the chief position at Wash U here at Barnes Jewish Christian Healthcare System. So we were treating patients with breast cancer right away. I was doing my normal sort of routine of seeing patients and discussing the different types of options. And, I offer, I always say 4 different ways. You can do nothing. You could have, use your own tissue to have breast reconstruction. You can use implants, or you can use a combination of your own tissue and implants. So that's essentially my consult, 4 different ways. And you sort of get down to it. And then you tailor the operations for the patient. But to answer your question about what we've been doing. So, during the COVID time, as we've started to restrict what goes through the operating room, we have never sort of stopped operating. So I've been operating throughout. We have, based on the American College of Surgeons, there's 3 tiers of how you address patients. So level 3 is for emergency cases. Level 2 is for cases that, kind of cancer cases that can't wait 8 weeks, or reconstructive cases that you can't really put off. And then tier 1, which is sort of your elective aesthetic operations, or just general reconstructive cases that are elective. It means the patient elects to go. So we've always been doing emergency cases here. Breast cancer has still been treated. So for the very high risk patients or aggressive disease, those patients have undergone mastectomy. For the past month or so, the reconstruction part, which is normally literally linked hand in hand with the breast cancer surgery, sort of mastectomy or lumpectomy.
So you're in with the breast surgeon, Dr. Sachs, typically when they're doing the mastectomy?
Typically, so, usually, at most, academic or private practices across the country, across the world, standard of care now is typically that you would be able to see a breast cancer oncologist and a reconstructive surgeon sort of at the same time or within the same sort of time frame. Because especially in the United States, if you have insurance based upon Women's Health Care Act 1998, by women's insurance, you are guaranteed breast reconstruction. And that's an important thing that people have to understand when they have insurance, that you're allowed to be reconstructed just the same way that you're allowed to be cured of your cancer, or if you undergo prophylactic mastectomy. So to answer your question, over the past month or so, we've had to really tone down the reconstruction, offering immediate reconstruction or even staged reconstruction with tissue expanders or direct implants or tissue transfer, where you were talking about the microsurgery. So we've actually had to tone that down, and really in some of our patients here in St. Louis, I know in Baltimore, Johns Hopkins, in Boston, San Francisco, Los Angeles, or big cities, small cities, medium cities, essentially the patients were undergoing mastectomies with no reconstruction, or for patients with breast cancer, low stage, they were being given neoadjuvant treatment, such as hormonal therapy, just to keep the cancer at bay until the mastectomy. So we've had that little transition period, but I do think, optimistically, and even though it's a little cloudy out behind me, the sun is starting to shine, because what's happening now in many places across the country, the cases, we're not past this pandemic. It's not going away for a while. There's no cure, just to be fully transparent. But the cases that we're seeing in the hospital are starting to trend down, especially in St. Louis and other big cities. And so we're starting to sort of put
excellent. That's great news.
Our feet back in the water as far as setting up tier 2 cases. So tier 2 cases, American College of Surgeons, mastectomy and tissue expander, mastectomy and direct implant, or mastectomy and soft tissue reconstruction. So literally, as we speak today, in some cities across the country, that's already happening. In our medical center, we're started gearing up for that. So literally starting this coming Monday, we're gearing up for stage 2, tier 2, where we'll be working, we'll be working with the breast surgeons to do tissue expander breast reconstruction, or
that's excellent,
or flap reconstruction. So we are getting back into it specifically for patients who have time-sensitive disease, like breast cancer, other cancers, and even contemplating for June or sooner at different sites, in our Barnes Jewish Christian healthcare system, elective cases, which is just the kind of case where, or problem, if you had a diagnosis and you had a problem and the surgeon said, well, let's fix this or let's address this, we're getting back into it. That being said, we're getting back into it with hand washing, social distancing greater than 6 feet, masks, COVID testing preoperatively. So
I was going to ask that. Are you doing 48 hours? What are you doing?
Yeah. So we have 48 hours, 72 hours. I think 3 days to be sure. You want to get that COVID test before, and then after you get the test, you want to quarantine, because you don't want to, put yourself at risk. And really, what that is it's not, it's for the patient. I mean, you want to know if you have COVID or not, but you might know ahead. You might be sick. You might have a fever, muscle aches, all kinds of stuff, or you might not have anything. But what you're also doing by getting that COVID test is you're protecting the healthcare system. Because if you walk into an operation and you have COVID and you don't know it, you're essentially contacting people around you. And those people around you are on the front lines. They're myself, nurses, anesthesiologists, medical students, residents, staff, everybody, can be exposed. So that's really what the COVID testing, if you think about it, that's what it's fundamentally for, is to protect everybody and the patient as a group, not necessarily the patient, but the patient and everybody treating that patient.
One surgeon said to me, it's kind of like when AIDS came out, you treated everyone as if they were positive, universal precautions. It's sort of that John said once again. I don't know what you think of that.
I agree completely. I lived through the, as a kid, and then, and then as a trainee back in the 90s, HIV, hepatitis C, we have something called universal precautions. And,
yes.
Everybody is treated like there's something that either we can give them or they can give us. So there's nothing wrong with double gloves. There's nothing wrong with masks. And especially in COVID time, who knows? Because the thing is, if we're really vigilant and we are, if we care about both ourselves and others around us, we're going to crush this curve. We're going to get rid of this, really bring it down. Because if you don't spread it, it's not going to spread. If you limit the transmission, it'll go away.
That's excellent. And Dr. Sachs, there's people listening in. Two questions so far just came in. You mentioned a few of the tier 2 surgeries. Is there a list out there of all of those surgeries? Is there somewhere online they can
Yeah,
go to?
so it's great, as this process has happened, there's no politics here. There's federal directions, of like phases, phase 1, 2, 3, and that's you could literally, you could go to Google and type in federal government phases return to work for COVID, and it'll tell you about phase 1, phase 2, phase 3, and those are based on certain criteria, cases as they go down. The American College of Surgeons, which oversees many of the specialties, the sister specialties that I'm part of, general surgery, plastic surgery, orthopedics, etc. They literally, you can find those tiers online also, and they give very strict recommendations about what's tier 1, what's tier 2, tier 3. But just very simply, tier 3 is emergency, tier 2 is like cancer urgent cases that have to go. Tier 1 is, sometimes we want a little lift this or a little tough. That's level 1, and that's the kind of stuff in plastic surgery that we need to be sure that for level 1 cases that it's a good to go. Meaning that we're not going to put people at risk. We're not going to be using up valuable PPE, personal protection equipment, and we're going to be safe for the patient.
Right. Yeah. Women have to put their vanities aside right now, and tier 1 needs to stay home. And if they're embarrassed, just don't go on a virtual website.
On hold. We never, women and men alike.
That's right. Having worked on Botox years ago, I remember. Another question. Are we talking about the COVID antibody test or another test? Are there other tests readily available? And that's someone that wrote in on the website.
Great question. So, I'll jump on my soapbox a little bit because you're letting me. So the 3 things that we have to look for in general for when the sky's going to be blue and the sun's going to be shining, figuratively and literally, is when we have a test, a rapid antigen test, which means that you can take a test right now, swab your nose or do something, and it says you have the disease, like right now. So if you have it, because if you have it, you quarantine, and if you're okay, you stay home. If not, you go get care. 2, antibody test. Antibody test means I have to draw your blood from a vein, and we have to look for an antibody, which is a protein that matches to the COVID antigen or virus. If you have the antibodies in your blood and you're tested for that, that means potentially you have immunity to it. Okay, That's important. That's the second of the 3 things that's important, because if you took somebody that was walking on the street and you tested them, 1, to see if they have the disease, they might not have it. That's good. Number 2, if you test them for antibodies, they have it. That means they've probably been exposed and they had it and they're immune. And then the third most important thing that we have to have is a vaccine. And once you have antigen test, antibody test, and vaccine, all that is going to be positive for society. Now, the exact question is, we're not testing for antibodies. We're testing to see if you have the disease. So, it would be great if you had antibodies.
Right.
We tell you that, but what you really want to know is, do you have the disease or not? Because if you're coming into the hospital, or you're coming into a private practice, or you're coming in anywhere for procedure, you want to know if you actually have it at that moment, because then you protect yourself and then you protect others around you.
Yep. Yeah, it's not. I think when this first came out, a lot of people were saying, "Oh, I'm young and healthy. I don't need to stay inside." I said, "Well, it's not about just you. It's the people around you that are elderly or compromised. So we have to really think about others, not just ourselves." So Brave, although we are a nonprofit about breast reconstruction. Actually, interesting, you said it earlier on. We're breast restoration, and we've been careful with our words because having worked in the industry, some women may not want breast reconstruction. So we always call it restoration, because if you speak to them and they want a prosthetic or nothing at all, that's fine. We just want to let people know of their options. And sort of we pivoted in this COVID time, Dr. Sachs, because we felt it was more important to talk to people about just the pure education around COVID, because people don't know what to wear, how to wear masks, what to wear. Do you wear gloves in the grocery store? So if you have any just words of wisdom for that, and then we'll have you on again if you'd like.
That's that's the beauty of, I think I always tell, so I send out like emails every week and every other day. And I tell everybody in our program here at WashU in plastic surgery, you can be leaders yourself, because, you're a leader when you wear a mask, or you're a leader when you don't touch your face, and you're a leader when you wash your hands, and you're a leader when you speak 6 feet away from somebody with a mask on. And so, the question is, the mask, the N95 means it's a certain level that it blocks the viral particles. So 95 and above, the 99 is the best. The 99.999, that's even better. But, I don't know if they've made that yet. But the N95 means it catches probably the 95% of the things that can affect you. And it definitely catches COVID. So the way it's done, if you're wearing an N95 mask, if you're around COVID people, it has to fit snugly to your face, and you shouldn't be able to smell stuff outside of it. That's called a test fit. But that's really if you're working with people that are COVID positive. The real reason why you wear the mask, it's really to prevent like water droplets coming out of your face or getting hit by a water droplet. So the majority of those droplets will be blocked by the mask, coming out of you and coming at you. So, and also, it makes people aware that you're thinking, and then it makes them think we're treating this as serious as possible. So, wearing the mask, a surgical mask, or just like, a scarf, that's a mask. An N95 mask, medical mask, has to fit on perfectly that you can't smell anything outside of it. And that has to be sort of done in a professional way to test it, called a test fit. But the other stuff is, don't touch your face. Wash your hands. Let the soap. I was on a Zoom call with my kids, and they were watching me. And I went to the sink because I was preparing dinner at one place and there another, and they were like, "Dad, that was too quick." I'm like, "What do you mean?" They're like, "That's not 3 minutes."
Oh, the birthday song or whatever, right?
You're right. You're right. So the thing is, the soap and water. So soap and water, what it does is it captures the viral particle, and then it takes it off and it lets it fall off. It gets it off your hand. So I
love that your kids are hall monitors for you. My 5-year-old is the same. And she's like, "Mommy, wear your mask into the store." So the kids are really watching.
Everybody can be a leader. And I think, if you put on that mask, even if it's just, I don't know, your local sports team, or it's a cool, friend's scarf that you found, I don't know, years ago. Essentially what you're doing is you're signaling to yourself is that this is different. I'm going to protect myself. I'm not going to spread vapor droplets, water droplets on others. I'm not going to get hit by theirs. And this is the key area: the eyes, the nose, the mouth. That's the place where
orifices, right? Yeah.
Something, if you touch something, you go like this. Boop. That's what you want to try to prevent. Even if you had it even if you caught it on your hands, even if you had it right here, as long as it doesn't go on the membranes, it's not going to get in. So don't touch it. Everybody, don't touch your face.
As I just did that to my eye. No, Dr. Sachs, you're amazing. We'd love to have you back on. Hopefully things normalize. You can do your tier 1, your tier 2, your tier 3, so you keep St. Louis looking young and fresh, and your footprint's new there. And we have to come out and visit you. And
we love it. It's I'm a New Yorker. Went to public school, College of Cornell, medical school in New York City. Then this is my 5th state in the last 3 decades. I'll tell you what, the Midwest is nice, and people are super nice, and
they're super nice.
Everybody's got the same problems here, so we're just gonna, put our best foot forward and help people, and and I'd love to, invite me back. I'd love to talk and tell you what we're doing next.
Thank you. And I have to say, New Yorkers are great too. You know that, because I've been talking to New Yorkers. They're all helping each other. So we get a bad rap. When I live there, they're good people too, but the Midwesterners. So we'll have you back, Dr. Sachs.
Thanks for doing this. This is really nice that you do this and educate people, and it's a really nice thing to do.
Now go wash your hands.
Bye-bye. Bye.